In this video, we're going to demonstrate how to correct for an inflare and an outflare. So an outflare is when the pelvis on one side is flared outwards, okay? From umbilicus to ASIS, we'll see a difference. We'll see the affected side is turned out. There are associated signs and symptoms with an outflare, okay? Or you can have an inflare where the ASIS is driven in. There are associated signs and symptoms with an inflare. And the flare really happens as a function of what's happening at the sacrum and the ilium at those junctions. And so inflare, outflare is not just this random thing, this made up thing. It actually is correlated and related to the position of the sacroiliac joint is what can drive inflare and outflare. So to correct for an outflare, so the ASIS is too far out. We want to pull it in. How are we going to do that? We're going to take this leg. We're going to take this knee across the body. So I'm going to take the insertion of some of these muscles. I'm going to bring that insertion medially. I'm going to make this tight. And then I'm going to have him contract these muscles. And if this is not moving, then when he contracts those muscles, it's going to pull the pelvis kind of this way. And so for inflare, I'm going to take this, for outflare, I'm going to take this in medially across the body into adduction until it looks like we've locked out those tissues, right? The pelvis is starting to move, the spine's starting to move. At that point, I'm going to say, Iden, I want you to push into my hands gently, push a little bit more, a little bit harder. There, 1, 2, 3, 4, 5, 6, and relax. Now, I would also recommend that you can grab the pelvis from the other side to help stabilize. So I'm going to hold the pelvis. See if we can get a good view here. Okay, now push into my hand, Iden. 1, 2, 3, 4, 5, 6. Relax. Push. 1, 2, 3, 4, 5, 6. Relax. Push. 1, 2, 3, 4, 5, 6. You would repeat that as necessary. That is for an outflare. For an inflare, it's pretty similar, just going in the opposite direction. So I'm going to have the knee up. In an inflare, the ASIS is medial, more medial when compared to the other side, and it would be an affected side, okay? There are signs and symptoms associated with inflare, and it's correlated to some other SI dysfunctions. We're going to bring the knee out, stabilizing the pelvis. And by locking out the hip with the pelvis, we're going to pull the pelvis away from the inflare. We're going to pull it kind of into an outflare or into a neutral. And when we get as far as we can, I'm going to have you push up into my hand. Push 1, 2, 3, 4, 5, 6. So I'm creating this as a fixed and stabilized segment. And we're using these muscles to bring the pelvis out of that inflare in an outflare direction. So push into my hand. 1, 2, 3, 4, 5, 6. Relax. One more time. Push. 5, 6. Relax. Good. And you would repeat that as necessary.